Thank you for taking my call. I got a question on what is a calcium score? How is it determined? And what's a good range?
Great question. We measure a calcium score in the coronary blood vessels. It is done by a CT scan, and it looks at old calcified buildup plaque in the supply to the heart muscle. So it has nothing to do with soft ongoing buildup of plaque, a remodification of the plaque. It's all old calcified plaque buildup. But it is important to know, because if it is a lot, then it will compromise blood flow to the heart muscle itself. So if you think about the anatomy, we are looking to see which blood vessels are most compromised. If it is in the LAD, the left anterior descending vessel, which is what we call the widowmaker, then that's the most dangerous. We do want to help our patients know that, understand what it means, and reduce that plaque buildup. But if we get a report from a patient who's at high risk that says they have no calcium plaque buildup and the calcium score is 0, which I've gotten many times, it doesn't mean that they are risk-free. It doesn't mean that they can do whatever they want with their diet. All it means is that there's no buildup of plaque right now that we can refer to. It doesn't mean that there's no ongoing modification.
How do you reduce it?
Well, lifestyle modifications, right? So we start first with what is your cholesterol level, what is your diet, what is your weight, what is your visceral fat, what is your personal history, do you have lipoprotein particle A? And then we start with dietary modifications, use of a lot of fiber in the diet, changing more to a whole food, plant-based type of a diet, and then using medications to help lower it. If it is not dangerous, we can start with supplements. But if supplements are not effective or not doing the job, then you must resort to medications to help reduce LDL cholesterol level, total cholesterol level, so you reduce further buildup of plaque.
So if you have something like a high calcium score result, how often would you recommend the cardiac inflammation panel then?
Yeah. Again, I think it depends, Dr. Pentland, on who my patient is, how compliant they are. I definitely will repeat it annually if there is a high score. Sometimes I will do it every 6 months if I'm instituting something specific and I want to target and see, but definitely annually.
What's a high score?
The score looks at the left anterior descending, the right circumflex, the right coronary artery, and then they give you a total value based on all of these vessels, and there's usually 100 is, below 100 is safe, 100 or higher is caution, and then the frequency of testing increases if you go above 200, if memory serves me right.
Okay, does a calcium score, does it also indicate the blood flow like in your legs?
So this is specific to blood flow in the heart and serving the heart muscle itself. Is it generally true that if you have plaque buildup in one area, you'll have it in another area also? You can say that.
Okay.
You can say that, yes, if there is vascular disease in one part of the body, well, why wouldn't it be in the brain or in the legs or in other areas? Because it's systemic, right?
Thank you very much.
You're very welcome, sir.